The following content is for informational purposes only and should not be considered medical advice.
Welcome to KC Wellness Talks. I'm Dr. Dawn Ipsen, pharmacist and your host. Join us as we delve into the world of healthcare with local providers discussing common health concerns many face and exploring ways to overcome them. Whether it's simple tips for home remedies or the latest in treatment technologies, we've got you covered. Today, I am so excited to introduce my guest, and I get to be in her office today. This is Dr. Amber Contant, a naturopathic physician in Lake Stevens, Washington. Thank you for being here today, Dr. Contant.
Thank you for having me.
Yeah, we're going to have a really fun time. You and I have known each other, I feel like a bazillion years, but
a long time. Yeah.
Since you and I are quote unquote only about 33, that just can't possibly be, right? Of course. But no, truly, we have known each other a really long time. It's been fun watching your career flourish. I know you've seen us at the pharmacy with lots of changes too.
Yeah, lots of changes, yeah.
I know.
It's been amazing.
We're just those women in the community that are pushing forward with positive change. Let me tell you a little bit about Dr. Contant's mission or her why. I love this. It's something she's working on currently, but it's to provide unwavering care and support to women, equipping them with strength and empowerment needed to advocate for their rights and create lasting change. Now, we were talking before we got on today, but let's just start right in there. Why don't you tell me a little bit about, your career and how this is evolving and how you're really coming to rethink your why and who you're seeing and how you're helping them.
Yeah. We'll start way back in the day. It's quite funny. So when I first started practicing medicine, I actually worked with one of my really great mentors. His name is Dr. Lyndon Capon. And when I first met him, everything a woman came in for, he's like, oh, that's your hormones, that's your hormones, that's your hormones. And I'm like, this crazy doctor over here has no idea what he's talking about. But I've been very fortunate, and he's been one of my biggest mentors, and he was right. Everything is, I think, related to our hormones and where it hits in our body. And I think as women, we are very discounted, and not because the system is against us or anything like that. It just, the research and people are just not up to date on how to appropriately or how to care for aging women. And so, that's kind of where I've been, is now to support this underserved group to empower them to live their best lives.
Right. I feel like you and I, with our careers, we've been a little bit underground for the last probably 15 plus years, in the sense of we've known and have been doing what's now just coming about as standard. And I remember just a couple years ago, these things were hitting the headlines of the newspaper. And we're like, oh God, that's so yesterday, when the data from, say, the WHI Women's Health Initiative trial was all basically debunked in one big swoop of a pen, and said that, oops, we've been wrong. And when we strip women of their hormones, when that first published, well, actually, we probably shouldn't have, and most of these women would have and can benefit from hormone replacement. So, am I kind of right?
Yeah.
You feel like we've been a little underground and a little bit, and we had to be experts.
Yes, yeah, and so it's kind of exciting to see more people talk about it. But a lot of people were pulled from their hormones unjustly and just meant to be like, well, that's just life, that's just aging, you just get to deal with that now. And you don't. And so yes, we've been doing it for quite some time. And so I'm kind of excited that it's becoming, well, number one, people are demanding more.
Right.
And so I like that people are more advocating
for themselves.
And becoming a little bit, more well-known, I think. But yes, we've been doing this for a long time.
Yeah. And what I'm seeing too is, and I think you're, talking about that in the sense of how the communities and how the public have changed the narrative. Women are feeling and realizing it is okay to talk about it. They're not crazy. And what's interesting is they are asking for that support.
Yeah.
Well, you're positioned perfectly to help them. And unfortunately, more Western medicine, it's not that they don't want to help them, but because their training and their mantra of treatment and care was answer is no, they're now having to learn. But you've already been there and done this. And so Are you seeing people, are they coming into you for the first time and they've already been there and been told no, or how is that looking?
So back in the day, the answer is yes. Like that was all we would see. We would catch the people that have already been like to their primary care or their OBGYNs, and they're just like, no, you're not a candidate. Here's an antidepressant. Have a nice day. But I would say now it's switching where some people have been told no, or people are starting to seek out an actual expert, just because, again, probably more it's in the media, it's in social media, and just more information, and so they're getting a little bit empowered and a little bit more information to find somebody who specializes in that area.
Right. Yeah, I agree. I think that's a little bit what we're seeing at the pharmacy as well, and but. Let's hit on it, because I think it's important to highlight you are a specialist and an expert in women's health and hormone balance specifically. Maybe share what was that training and how have you gotten to where you're at with this knowledge and this experience?
Yeah, I mean, so a lot of people don't know, because I still hear like people are like, oh, I went and saw this other naturopath and their experience for their hormones wasn't that great. It is a specialty, unfortunately. It still is. It has taken a lot of continuing education to kind of get here, and like I said, I've been kind of blessed to have a mentor who was already in the field and worked for different longevity clinics and stuff like that, and so having that experience, but it's a lot of continuing education and seeking out that additional training in it, because a lot of people don't know, but when I went to school, we were told estrogen is going to cause cancer, and all
even
these
within
things.
the naturopathic doctor training.
Yeah.
Really? Okay.
Yep. And you should keep them very little. You should do it. I actually have a very vivid memory. The first time I had a woman who had a hysterectomy, I think she was like 32 years old, complete. And so no ovaries, wasn't producing any hormones whatsoever. And she really needed some. And so she was having hot flashes, quality of life was not. And I just remember being so scared to prescribe her this, just because that, the Women's Health Initiative and what they're teaching in schools, they scare you of it. And it's just very much unjust.
Right. So you must feel pretty empowered that not only do you have your experience and your training and the results you're going to get, but now even more the common lay and the different types of medicine practices are kind of looking at it now and going, okay, yeah, we see where you're at. I mean, it feels good, doesn't it, that we're in an area that's not so underground and more accepted and expected at that.
It is exciting, because I remember like the conversations I used to have, people were like, oh my gosh, and there was just so much fear, and I'm like, this will really increase your quality of life, like having to really just comfort them, and now people are having more education, and so they're willing to feel better.
I remember you and I having to do that early on and be like, it's gonna be okay, we promise, we know what this is, and there's ways to monitor and ways to be safe.
Yeah, exactly.
Yeah. Okay, so women are getting after it, and they're seeking treatment and care. One of the things you and I talked about before, which I think really speaks highly of you and where your focus currently is on that helping women find their self. I loved that when you said that. I think it resonates really, really well. Tell me a little bit more about like, what does that mean? Who are you seeing? Yeah.
So, I mean, this is a part of menopause that nobody talks about, right? We all talk about the hot flashes, the vaginal dryness, like the things but nobody talks about this lack of self that happens. And so this is my really big, like, I want to empower women. I want to be able to give them back themselves, is they don't feel like themselves. They become this angry, irritable, anxious mess. They're not sleeping. They don't enjoy the things they used to enjoy, and I have people that come in my office and sob because, and they directly say that they don't recognize themselves in the mirror anymore, and that they're a shell of a person. And so reestablishing hormones, gives them back themselves, and that is like one of the greatest things that I do.
Yeah, that's such a subjective thing, but I think it's really neat that women have that awareness of like, I don't know for sure what's wrong, but I'm not me right now. And good for them for working through that process of what is going on, right?
Yeah, because hormones do more than hot flashes.
Yeah, and there's more than one hormone too. Like
Yeah.
I know from your
Yes.
experience and how you manage patients from the pharmacy side of seeing it, like it's not just estrogen and progesterone and testosterone. You do such a fabulous job too with their thyroid. Like, is that pretty common that you see thyroid imbalance in patients, women, these perimenopausal and menopausal women? How often is that occurring?
I would say, I mean, it's quite often because again, this isn't, you're not going to find this anywhere in the literature, but in clinical practice, I noticed that a lot of our hormones work synergistically, and when one system is stressed, it places stress on the other system. So if you're supposed to be a team and you're all supposed to be hauling your own load, right, and one part of your team member is not doing its job, it's going to put other stress on the other team members. And so we do see a lot of imbalances, and I think it's just this synergistic thing. Plus aging, we slow down in aging, and all of our organs just kind of slow down, and I don't think thyroid is any different.
Yeah, that's probably true. Yeah, seems like the rates seem higher in women than in men currently, and I'm not exactly sure physiologically why that would potentially be, but maybe it's our stress. I don't know.
I haven't seen anything. Yeah. Unfortunately, I think another reason why our thyroids are starting to kind of dip is thyroids are concentrators, right?
Oh, yeah.
And they concentrate halogens.
Ah.
Yeah, so they're supposed to concentrate iodine, which is really wonderful, and we need iodine to make our thyroid hormones, but that whole family, which would be called the halogens, they concentrate all of it, so they're going to concentrate chloride, fluorine, bromide, which are just really common things.
And are you thinking we're getting exposed to that environmentally, or what does that mean to a lay person?
It's from our environmental.
Okay.
Yeah.
Anything in particular we should?
It's our chlorinated water.
Okay.
Fluorine, in our water. Bromide, it's in a lot of our breads.
Oh, okay.
Yeah, they use it a lot in our grains.
Okay, I see.
Yeah.
Yeah, so what are some of the symptoms of these women who are coming in and, you've got this overall, I guess we'll call it a goal of helping them start peeling back the layers of this onion, so to speak, to help them be more in tuned and back to their self. Are there symptoms that kind of go along with that you've found to be pretty common, or
with the thyroid per se, or just
no,
overall?
just in general, just the sense I don't have a sense of myself, I don't know who I am anymore,
I think the irritability is probably number one. Again, these are just funny things that I've kind of come to realizations over the years. We all know what a Karen is. Right?
That's been coined as quite a term lately, that Karen. I feel sorry for women whose real name is Karen right now. We love Karens, just so you know.
We do.
We're on your team.
But here's the amazing thing is I've come to the realization, I think most Karens are perimenopausal, menopausal women that are just angry because I will tell you, we do have quite a few that come in and then we balance them out and they are sweet as pie.
What's their name changed to when they do that? I'm teasing.
Is there a new one?
Yeah,
Lisa?
Oh, gosh.
I'm not quite sure.
I don't know either, but
But sorry, I got a little distracted.
Sorry.
But, I can't remember the question.
Oh, just like what? So symptoms. So you're saying irritability.
Yes.
So irritability is a really big one.
I would find that the irritability and anger, those things that you used to allow to roll off your back, right? Where you're just like, it's not that big of a deal, and now you're just like ruminating about it.
Okay.
And that irritability and I think brain fog are kind of some of the biggest ones, in addition to, going to be more of the traditional symptoms such as the hot flashes, night sweats. But I think really for me, it's the mental irritability and anger that comes along.
Okay. What about fatigue? Is that playing in? Because I don't know. Yeah. I feel like I'm kind of in this group, so to speak, about that age, right? Yeah. Where it's like, wow, there are some days where I just feel like my tank is empty, right? Yeah.
Fatigue is really big. Sleep issues are another thing that come along. Anxiety.
So that's just not like age and I'm just supposed to sleep less now?
That is not a thing. You actually need more sleep as we age just because you need more recovery, because that's when we produce, a lot of our hormones that allow us to heal and our brain to clean. Our brain cleans at night, right? So if you're not sleeping, there's less scavenging that goes on and we're more likely to develop Alzheimer's, dementias, and some
Oh,
of these
gosh.
other things.
Yeah.
Yeah.
We don't want that.
We don't want that.
Yeah. Oh, wonderful. Yeah. And so, yeah, my saying with sleep is always rest, repair, recover. You've got to sleep or you can't do any of that.
Yeah.
But yeah, that's interesting how that feeds into getting rid of the inflammation and oxidative repair, all that. All right. So what are some of your favorite tools? I know you've got like some pharmacy tools because I get to see those, but do you have other like lifestyle things that you instill as well, or?
Yes, I do.
Okay.
And the way I say that is because I also find that it's really hard to do some of this lifestyle stuff. So I always bring on, quite honest, I bring on pharmaceuticals. I replace a lot of hormones, and that is my first one.
Okay.
Because I think it is very difficult to expect lifestyle changes when you feel like garbage.
I 1,000% agree because
And-
if they I think most people know what they should be doing, and clearly most people are probably quite capable.
Yeah.
But if you don't have the resilience or the motivation or the energy or whatever it is, you can't get a change from A to B unless you've instituted another type of change.
Yes. So I generally bring on pharmaceuticals first, and we reestablish that balance, and then we start working on the other things. Because, you know, giving back some of these hormones, whether it's thyroid and give you more energy, whether that's your hormones, and so we're sleeping better, that mood is better, that motivation is better, right? Because once you feel better, you can take better care of yourself. So yes, so that's why there was just a little bit of a hesitation. And so,
Totally good.
You know, after that point, we work on, like, you got to sleep. Like, sleep is number one, right?
Okay.
And
And thank
working
goodness
on
for progesterone on that at
Yes.
times. That can be helpful.
very helpful.
Yeah.
Yeah. Because as our progesterone levels decline, you know, our sleep. But estrogen also plays a big role in sleep quality as well.
Yeah.
Yeah.
Right.
So, and then too, estrogen there's connection with melatonin, and so as our estrogen declines, we actually produce less melatonin.
Well, that's a big problem. We need
Yes,
that. And
right.
definitely need that conversion.
Well, and then now we're going down the rabbit hole because now as your melatonin declines, your growth hormone declines. So
Okay.
everything's intertwined, right?
Right.
And so we just don't sleep as well. We have trouble sleeping. We don't recover. We don't repair as well, right?
Which probably
So-
makes us more agitated and irritable.
And so they're all like, there's all these little things that happen from one simple thing.
Yeah. I love that you have found that you have the tool of using the pharmaceuticals, using bioidentical hormones to sort of let's turn this race car in a different direction. Let's just flip it around that corner and get it progressing somewhere else. And then you can start to see these other progressions and then poke at other lifestyle things.
Yeah.
I think that's awesome.
Yeah. You know, I have a lot of patients I catch and they go there and they see other providers, and these providers have really amazing plans for diet. They have really amazing exercise, amazing sleep, amazing like supplement plans. They have all these great things, but that person still feels like garbage. And so how are they going to implement any of that? And the answer is they don't.
True.
They don't, because they still, and so that's why we do all these things first, and then we implement those other amazing plans.
I mean, I know you and I know this, but I think let's just kind of talk about a second. Like, I tell women when I'm counseling them on hormones, we're going to put the hormone in your body. We can get it in there pretty quick, but it's going to take a little bit of time. So what's kind of a reasonable or standard, like how much time do you find we as women need to have as patients when we start to work with these tools and these pharmaceuticals?
I mean, I think you'll see some improvements. It really depends on how connected to your body you are.
That's true,
because
too.
I do have some patients that are like, "Ooh, my kidney hurts," right? And I'm like, well, "How do you know it's your kidney?" Right? Or they're like, "This ligament right here hurts," right? Those people feel the change much more quickly, and they can feel it within 1 to 2 weeks.
1 to 2 weeks.
But then we have people who are like, I'm like, "There's a giant wound on your leg," and they're like, "Oh, really? I didn't notice." Those people are going to take much longer just because there's not that connection. And so I think it's fair to see to 3 months, but I would say for true hormonal balance, about a year. To get you completely to a stable level. Because here's the thing too, is I don't give everybody the same thing, right?
Right? You can't, right?
Every person's hormonal balance is completely different. Mine is different than yours.
Yeah.
And, some people really like to go on labs. I don't just go on labs, you know. I use labs for safety and make sure that we're in a safe range. And there are certain levels that I like to hit because research might show, hey, this certain level of estrogen, you're going to have better bone health.
Oh, okay.
Right?
Yeah.
But the other half is the patient, and so we combine those two things together to get their hormonal balance. And then so it takes us about a year because if it was easy or if it was the same for every single person, then it could be much quicker.
Right. Well,
but you will feel better
as you're progressing through.
Yes.
Yeah. And I think you hit that on the nail. Like, if it was fast, if it was easy, if it was cookie cutter, pharmaceutical companies would just be manufacturing these things mass, number one. We wouldn't need the individualized care of a compounding pharmacy where I'm making one specific prescription for one specific patient, and that you wouldn't need to be that specialist on how to fine tune it. It's kind of like taking a standard car and turning it into a race car, and how do you adjust the airflow and the fuel and all the other manipulations that need to be done to make it run at its very best optimal, right? Yeah. So thank goodness you're an expert in this. Oh my gosh. Yeah, we definitely need that. That's amazing. And I, you and I have the same philosophy where it's like, I just so full-heartedly believe in personalized medicine. Yeah. And it's one of the reasons why, I like to advocate. Yeah. I know you don't like to go to DC and push, talk with congressmen, but I will do that on our behalf.
Good. I'm glad somebody will.
Because I think it's important that we do have those voices to advocate. And you're advocating in your own way by getting these women stronger and more resilient so that they can have their own voice. And let me tell you, a patient voice is much more profound than a pharmacist voice. Yes. So good job there.
Well, thank you.
Yeah. So let's see, we've talked a little bit about hormones, about thyroid. Are there other tools or medicines or things that you like to use that can be helpful in different patient cases? Or are there other things in lifestyle even that help to guide with that sense of self and getting women back to where okay, I feel like me again?
Yeah, I mean, there's so many things and there's so many things. Unfortunately, I think as women in transitioning through perimenopause, we could spend days talking about the things that actually occur in the body and the struggles that
Is there a top one or two we haven't hit yet that you think we should talk about? Yeah.
And so I think brain fog and weight gain are probably the biggest things, because also, if your brain isn't working, if you forget all the time, that executive function, that motivation goes away.
Yes.
That's a big portion that you're not going to feel like yourself. You're not going to feel good. And then weight, if you're struggling and you can't get those pounds off, and now visibly you look in the mirror and you look different than what you think, it really impacts yourself.
Right. Okay. So those are sort of some focus areas: brain support and weight. Any particular areas or tools you like to think about or consider? And I know I'm asking really pointed questions. Yeah. And I know hesitancy is because each patient is so very different.
I know. I wish I did cookie cutter medicine because my life would be easier.
Well, and I know you don't, and that's great. But yeah.
So everybody's a little bit brain health. I think testosterone is big. Yeah. It is so important for females. I know there's no FDA approved testosterone product on the market for females because I'm really snarky, you guys. And so I will usually tell people it's because, they don't want you to have a brain. They don't care if you want sex. They don't care if you have muscle, right?
Yeah. It's okay. You can go on your soapbox. We're in a safe area here. But yeah, you're right. There is no FDA. I wonder though, part of it too is that it is so individualized on dosing. Could they even formulate something that would be able to be used universally and show safety and efficacy? All those things the FDA allows.
I would like them to at least try. I mean, they're not even trying for females.
You're right. They're not. Right. Yeah.
Okay. Now I'm going on a little soapbox. So the Women's Health Initiative, right? We took hormones away from women based on a crummy study that is debunked several times. But, for men, they do so much and then they move it really quickly. Right? There's been talk just recently about how testosterone for men don't cause heart attacks and strokes. Well, lo and behold, they just removed the black box warning from males' testosterone, and we can't even get them to even consider testosterone use for females.
Right.
So it's frustrating, and this is why I'm here.
Yeah.
And this is why I'm passionate about these things, is because there are different ways we can use compounding pharmacies to bridge that gap.
Thank goodness, at least. Yeah, and I'm happy to be a part of that, and take into consideration the safety, the efficacy, and all those quality issues that are super important as well. But brain health and testosterone, I think that's a huge one. The other one I sometimes hear about, and I think you play with it a tiny bit too, is methylene blue.
Yes, that is one. I do. I do like it.
What do you find it fits in or helps? Like, when do you think about that? And I know there's some limitations on the who and the how and the why, but
we'll pull back the curtain a little bit. I was the one who was telling you.
Yeah.
I'm like, Dawn,
do you know about this?
Do you know about this?
Yeah.
You need to do some research on this for me.
definitely did my homework. This is how I keep up to date too, and what's out there. But
and so I think it's a phenomenal thing. It is hard. Why I'm always hesitant about everything. You'll learn me.
Well, sure, but conservative is good. Hesitancy is good.
Yeah, and the reason is because there's not always a right answer, right? Two things can be true at the same time. So for methylene blue, I think it's a really wonderful tool. I think it's fantastic. It revitalizes the mitochondria, which are the powerhouse of,
energy
of the body, specifically for the brain, though. And then it also helps our neurotransmitters, so our serotonin, our dopamine, right, which decline with age. Think about, we all become a little bit more of a sun seeker as we get older, because the sun helps us produce serotonin and dopamine. And so it helps it linger a little bit. So it can also help with a little bit of mood and depression and anxiety. So, and because of the mitochondria, right, you have better thoughts, clearer thoughts.
Faster.
Sharper. Right? And so, and I've seen a little bit, maybe you could talk about this, they're finding that possibly improving some plaque formation in Alzheimer's and Parkinson's.
They are doing research currently for dementia and Alzheimer's, prevention primarily, which those are hard things to study. Is number one, you have to have clear ways of predicting who would get dementia or Alzheimer's in the first place, and then try to do your intervention early enough that it's not swayed by, are they in disease state already or not. But definitely so. The only thing I want to say from a pharmacist standpoint of methylene blue is consumers out there, because I know there's just a lot of people in our community might be watching this, that you can actually Google and look up and probably buy some type of methylene blue right off Amazon right now. And the problem is methylene blue, there is a pharmaceutical grade of methylene blue, which is what obviously you and I work with. And then there's a dye grade of methylene blue, which a reagent grade, which is used in research labs to stain slides, and it's also actually used to stain blue jeans. That's a dye for blue jeans. And so it is definitely a buyer beware. Cheap is not good. And the difference is with the pharmaceutical grade, ours is what's called USP, or United States Pharmaceutical grade, and it is tested and screened to make sure it does not contain any heavy metals. Because unfortunately, dyes often contain heavy metals. So I just want to make sure we're clear that we are talking pharmaceutical grade.
Thank you, because I was actually going to bring that up, because that was also a little bit of my hesitancy to talk about methylene blue as a positive thing, even though I think it's phenomenal and I think it's so wonderful for the brain, is because there's so many people on social media that are drinking that
blue tongues.
And all this stuff, and they're getting it not from a reputable source, and the heavy metals, and
and it's dosed by weight. This is not just about this looks about right,
And so I just wanted to make a clear distinction of what we were talking about. So thank you.
Happy to help you with that. It's dosed by weight and also pharmacy size. There are potential drug interactions, and there's also potential contraindications or reasons a patient would never be a candidate.
There's this lab we run, and it's because it can cause oxidative damage, right? And that should be ran before you start it. And so
I'm glad you're doing that. That's so cool to hear. Of course you are.
So if you're not doing it, right, it can be a problem. And so it kind of freaks me out seeing all these people doing all this, because just because it is a wonderful tool and it's super exciting and all this stuff, you know, you still have to be careful.
Right. And that's why you need a very good, knowledgeable, well-trained physician, and you work with a really great quality compounding pharmacy.
Yeah, exactly.
That's the synergy. You want that team approach. I agree. Yeah. So I think we beat methylene blue up pretty good. But I think it's a fun thing to talk about. And I don't think that, I mean, I do think people in the community know about it because they're on social media.
Yeah.
They're seeing the TikTokers. They're seeing
With
the
the blue
influencers with the
tongues.
blue tongue.
Yes.
By the way, we make ours in capsule form, so you do not have to have a blue tongue.
Okay, but the fun part is that your urine does turn bright blue.
Absolutely does.
And if you mix some B vitamins with
Yep.
it, then you get neon green.
You do. And you do have to be a little bit careful because it can stain toilet bowls.
Yes, again.
Luckily, it doesn't happen often, but it can happen. And
Yeah.
so, but yeah, kind of a fun party trick at the same time. But yeah, you know, and you should take it with vitamin C so it activates it too. Yeah, good little trick there too. But okay, let's see. I think we diverged. I'm sorry about that. I got on a soapbox with you there.
That's okay.
Yeah, so lack of self, you know, we've got weight gain, we've got the fatigue, we've got brain, mental fog. Some of the other things we talked about, like obviously hormone balance, and that can lead into hair loss. Like, are you finding that's a big part of that loss of self?
It is, right? Because
Yeah.
again, that's that outer, you know, your outer self is changing. And I think men, again, sorry, I don't mean to be anti-man.
We love men too, by the way.
But
yeah.
it's just, you know, I think women just have it so much harder, and we just don't give ourselves credit of the things, the transition that we have to deal with.
Here's my theory on part of it, just to kind of like lighten the research politics side of it, is like, you know, it wasn't very, very many decades that our lifespan was much shorter than it is. You know,
That's
it's
true.
like we'd procreate, you're kind of done, you're going to die in your, you know, 50s, 60s, maybe 70s if you're lucky. Well, now we're commonly living as, you know, humans in the United States into our 80s.
Much longer, yeah.
So if you think about most women on average hit menopause about 50, we've got to figure out how to navigate another 3 decades of life. Whereas before we really,
Without,
we didn't have that much more time typically before that we would have to learn how to navigate that. And so, I mean, even the crummy pharmaceutical hormone menopause treatments that are really not used anymore, they've only been around for a handful of decades because it's a newer thought process in that sense that we have a whole nother life we get to live.
Yeah.
Yeah.
Yes.
Is that a nicer way to soften it slightly?
Well, I was just talking about
untrue.
Yeah, I was just more talking about it in the sense that guys can lose hair and they can become like
That's
the
true.
silver fox, where women lose hair and like now, gross.
What is wrong with you?
Right.
I
And so
know.
in that
That's
sense
true.
is what I was like saying, that women, we get to deal with so much, right? We got to figure out how to manage our wrinkles, where guys are like, oh, they're looking distinguished.
Yeah, and the sunspots and the aging skin and the lack of hair is a really
So that's what I was saying. We just have it harder.
Yeah, the socio-status and expectations are different.
They are. And so,
Yes.
yes, hair loss in a female is very, can be very hard.
Yeah. Yeah. So there's lots of things that can be done about that.
Yes.
Or at least attempted and put forward. Nothing's a magic fix.
Yep. I think of hair as extra.
Yeah. Okay.
You know, it's the extra. So, you got to make sure your nutrient status is good because, right, it's going to take care of all of this before it takes care of the extra pieces.
Right.
Right.
Okay.
And so we got to make sure that that is good. If your thyroid isn't great, hair loss, age with hormones, we get the micronization of the hair follicle, so that hair follicle just shrinks and then eventually just falls out.
Right.
So it gets smaller and fall out. And so there's so many reasons. And then there's just genetics.
Yes.
Which is very unfortunate for that genetic population. But the good news is we do have some pharmaceuticals available that I would say are pretty effective if your thyroid's good, if your hormone status is good, right? We got to make sure all these
Check these precursor boxes first.
Yes.
Yes.
And make sure that we're doing all these things. And then if it's just really a genetic thing, or in short term while we figure out all these things, because women also don't be like, I don't want to figure this out 6 months later while I'm losing hair. Like, do something to stop it now.
We got to slow this process down. Yeah.
And so we can bring on different pharmaceuticals such as minoxidil, spironolactone. There's a bunch of different ones. It's kind of exciting because we can compound them together in different formulations, which can be very effective.
Yep. So we can do some topicals, of course,
Yep.
and those have their own challenges at time. Women have hair of length, so we got to figure out if we can part it and get it where we want it on the scalp, and
Yep.
not make their life cumbersome with pillows and anything else. But I think the most exciting thing that I've seen, I know you've used this tool in some of your patients, is that the evidence with oral minoxidil, tiny
Yes.
low dose oral minoxidil, of being quite effective. And,
Yes. And I like it. So the reason is because if you've ever used the topicals, they
Yes.
suck.
Yeah.
And it's because they kind of make your hair a little crispy. You've got to be super, super consistent. It's got to be twice a day,
Yeah.
for a lot of these things. And so I have a lot of people that have tried them and they just can't be consistent to actually get them to work.
Mm-hmm.
And so with these low dose oral,
Yes.
right? Number one, it's low dose. So we never see any side effects.
Yeah.
And
Blood
then-
pressure changes or
no,
anything
we
weird
don't
like
see
that.
any of that
Yeah.
because of that really low dose, and
Yeah.
then it's just something that's so much easier. I will give a little caveat with that
Yeah,
though.
yeah.
It grows all hair equally,
Yep. So,
not just on your head.
yeah.
all the hair.
Careful what you wish for. If you were a more
Yeah.
hair follicle body,
Yep.
you could get some more.
Yeah, but a lot of my patients are like, you know what? I when they're younger, they're used
Yeah.
to. I'll just get rid of that all, and then
Yeah,
I'll
let
that
it
grow.
focus back in my lush
Yep.
locks.
Yes.
Oh gosh, yeah.
Yeah.
Yeah, and just like with all these other types of therapies and hormones and finding that balance and finding this stuff, not overnight things. Like these things takes
Yes.
months and months, and
You
of
got to
course,
remember, hair grows in 3-month
Yes,
cycles, so you won't
yes.
even see a change
Right.
till month 4 to 5.
Correct. Yes,
Yeah.
exactly. So, and then, hopefully, I know that you work hard to correct all those underlyings, because sometimes when these therapies are stopped, we get to go back to where we were in the first place if the base isn't fixed. Yeah,
Yes.
that's for sure. That's for sure. All right. So one of the other things I think we sort of skirted over, you brought it up a minute ago, is like weight loss is a really big concern for women. So, I mean, do you have a tool or two or things you think about when you're helping these women with that?
I mean, kind of everybody's heard about like those GLP-1s, right? They're
Yeah.
all over. Everybody talks about it, and I think if you look at the research, they are the most successful weight loss product that we have on the market compared to a gastric bypass almost. Like they're
Yeah,
pretty
absolutely.
effective, which is why everybody is talking about them.
Right.
I definitely think there's correct ways to do things
Yes.
and not do them. But I think I can't remember the name of the study, but there was just one that came out and it showed that people on hormones, HRT, with
Okay.
the GLP-1 had more success.
Yes.
And so that was pretty cool too, because again, these are tools that to help the aging population, specifically our
Right.
women that really struggle with that middle tire.
Right.
One of the reasons why I really like GLP-1s are, I like to tell people, right, we give you an ibuprofen.
Yep.
There is no ibuprofen pathway in our body.
Yes.
There's not. It doesn't
Yeah.
exist, right? So
Right.
we're creating an abnormal process in the body. With the GLP-1s, they're just making a pathway, a signal in the body louder
Yes,
that already
is
exists.
there.
And I
Yeah.
think that's why there's just so much great success. And so for my women, they just work phenomenally as a tool. I do
Right.
have people that use them as a magic wand, and the weight
Oh.
loss isn't sustainable.
Yes.
You will gain on the way back, but it is a
Yes.
phenomenal tool if you're doing lifestyle changes, hormones, and all these other things as a package.
Right.
You can have some really great success.
Right. Yeah, I agree fully, and I'm excited also with the GLP-1, and I like you're seeing as well. There's just more and more research and articles coming out. I actually just wrote a talk on GLP-1s and another diabetes drug, not looking at them even for diabetes or what they're indicated for, but for increasing lifespan
Yeah.
and health span. Health span is a really cool newer term where
It
it's
is.
like.
Yeah.
I kind of like it, where it's not how long you can live, but how long can you live well. And the research is really interesting there, and I'm excited to see what the manufacturers will probably be the ones leading that, since they have these patents and they have motivation financially to get extensions and FDA approval for indications of other things besides diabetes and weight loss, which are the two that they have currently. Yeah. And then, of course, they're complicated at the moment. There's politics involved. There's, all sorts of things there. But access, we're fully aware access sometimes can be an issue. It may become more of an issue. We're hopeful that government steps in and changes where we're headed with this. But
Yeah.
of course, there's injectables, there's orals that are being studied that are not approved yet that kind of look possibly promising, and even also available as a sublingual form that sometimes you'll see used out there as well. But so I know you've got a few of your favorite options in that. And I think it's good you brought up GLP-1s. Is there anything else in that weight loss area that you sometimes
Like
consider?
lifestyle?
Yeah, I mean, I guess it would be lifestyle, right? I mean,
Yes, well, because the research, here's the hard part. And a lot of people talk about how, and I might get some hate for this, that there's a big metabolic shift that happens when you're 40, and it's not true.
Okay, tell me more about that, because I think that is true. We do hear that all the time. Oh, you're just getting fluffier because you're 40.
And it's not, it's because there's severe muscle loss. And it finally caught up with you because the hormones have taken a dip. And so our recovery, our muscle retention has declined. And so what happens is people will lose muscle, but they'll gain fat, but the scale still says the same. But they might notice that the belt's getting a little tighter, but they're like, it's still the same weight. And so by that time that scale tips, we've actually lost a significant amount of muscle. And our muscle is our metabolic hormone. And so really we see a loss of muscle after the age of 30, especially, and it's getting earlier and earlier because we're just more sedentary.
Okay.
But there's not a true metabolic downshift until we're 60.
Okay.
So it really has to do with muscle mass.
So
one of
weights are good.
Weights are fantastic,
I
right?
love it.
So you have to
Thank
do things to maintain your muscle mass. Testosterone's also another one, right? That does it. But eating adequate protein. I think we're heavily under-proteined. I think I saw an article that said that most women in the United States get about 50 grams of protein. That's not even hitting your RDA. Your RDA is that recommended daily allowance, which is the amount you have to get to prevent death. It is not how much you need to be healthy. It's just to prevent death, right?
Great. Such success in that wording.
Such success. Yeah. And so we need a lot more protein, especially if we're going to be more sedentary and these things to preserve that muscle. And so I really like my patients to do about 1 gram per ideal body weight.
Okay. Well, we better just start really.
I know, we should have a rotisserie chicken right here between us or something.
Yeah, hard-boiled eggs. I mean, we've got some choices, right?
Yeah.
But I mean, it's true, right? And our Western diet does not do us any favors in that also, in that sedentary lifestyle. I mean, this is my favorite time of year. I call it go get dirt therapy. But part of what you're doing is, working in the garden and you're moving soil and you're lifting things. And gosh, it just feels so good, right? And that's like, we need to do that more and more.
We need to do that more. It's hard in the Pacific Northwest.
I know it is. We got to take it
6
while we
months
can.
out of the year, it's kind of dark.
Yeah, but today we are good. So
we're
going to get in there. Yeah. Well, let's see. If we had to leave our listeners with one closing thought or something inspiring, what do you want to leave them with today?
I don't know if it's inspiring.
Well, it doesn't have to be. You're already inspiring enough.
I don't know. I just see women and we're just told that's just life. I think as we age and as we transition, these should be our best lives. Your kids are out of the house, you have this ability to go and do the things that you want. And if you feel crummy, it's not great. And I guess my message is you don't have to. You don't have to. We have things that are available that can give you just a better quality of life and to give you back yourself. And so,
Find providers
around that are specialists. Know that not everybody is a specialist. Hopefully one day that you'll be able to go to your PCP, and maybe it will be, that's the hope, is to expand the access, but right now that's not the case. So find somebody who's actually a true specialist in this that can help support you, because you don't have to live like that.
Yeah, that's amazing. Yeah, well, thank you so much, Dr. Content, for taking time today out of her very busy schedule to have this conversation. I mean, it's valuable information. I knew your message needed to be heard by our community, and so I'm grateful for you on that. I want to make sure we let our listeners know how they can connect with you. And so it's Dr. Amber Content. She's the owner and main physician. You have others here as well, with Lake Stevens Natural Medicine, and have a website of lsnaturalmedicine.com. And of course, you can call the office. The phone number here is 360-291-6005. Thank you again for that.
Thank you for having me.
Yeah, that's all for today's episode. Thank you so much for listening. If you enjoyed what you heard, please subscribe to our channel, give this episode a like, share it with your friends and neighbors. Stay tuned for more insightful discussions on health and wellness. And until next time, take care.